critical thing for rural women is to make sure that they're looking after themselves. As the expression, to make sure you've put on your own oxygen mask before you help other people. Being agile, not fragile, really means that you've got that, I guess, a suppleness and an ability to sway in the wind and not be blown over. I think it's important that we actually learn skills and techniques for managing the feelings that can sometimes be quite overwhelming, particularly when you're going through change and crisis.
In crisis there is opportunity. I mean, the classic example of that, I think there was more millionaires made in the Great Depression than any other period in history. Having something to strive towards and having that sense that you're moving forward with your life is very, very important for your well-being.
This webinar series is an opportunity to get some new tools, but also to look at, are you maintaining the tools you've already got? How do you be in a position where you can take advantage of what the opportunities are coming out of a crisis?
Not only giving people great information about well-being, but also giving them some great information about how to improve themselves professionally. People have shown remarkable agility to deal with extraordinary demands, but it's also important that while people are doing that and running on full revs, that they are looking after themselves at the same time so they can maintain that resilience over time.
I think one of the important things about this webinar series is that the people involved understand rural Queensland, they understand rural people. You can have privacy, you don't need to identify yourself when you're asking a question. There's lots of opportunities, but you need to look after yourself so that you can actually take advantage of those opportunities and be in a position to look after the people around you and make sure they're ready for them too.
Okay, tonight what I'm going to be talking to you about is the magic of sleep, which is one of the four pillars of wellbeing, which is, I guess, one of the four presentations that's focused on the wellbeing side of this series. The other topics that we will cover will be focusing more on the business side, but they're also important as well in terms of considering our wellbeing, because in terms of keeping well, I mean, we do need to focus on sleep, exercise, diet and social connection just to keep ourselves well, but we also need to feel that we're heading towards something. So that's the other thing that's really important in terms of those other topics are very important in terms of well-being as well. And well-being obviously supports people's performance professionally, so they do gel in very well together. As I was saying, tonight we're focused on sleep, but we're going to get some help over the next 4 sessions from Northwest Remote Health, and also from Outback Futures, and they're going to talk to us about the mental health benefits of exercise. And then again from Northwest Remote Health, we've got a dietitian speaking to us about the benefits of diet to good mental health. And then we're going to talk about social connection and how important that is to maintaining your wellbeing. And you're going to be stuck with me for that one again. So moving right on to the topic of tonight, we're talking about sleep and just how important sleep is. Well, as we were saying, sleep is a pillar of well-being. And in terms of those physical things that we do consider very important, often we think about having a good diet, good food, making sure we get plenty of exercise. But sleep is actually equally important. It's equal to good nutrition and a good level of physical fitness. It plays a vital role in growth and repair and learning and memory. That's also really important, and you may have experienced this if you've needed to learn something quite quickly in terms of cramming for exams or something like that. Without sleep, we don't learn new skills so well. And obviously, for repair from an injury, also very, very key in terms of maintaining that good level of sleep. It's probably as important for our physical health as it is for our mental health. Often we think about the sort of feelings of feeling tired or fatigued when we don't get sleep. But often what we don't consider is the effect on our immune system, for example. and also our ability to repair from injury, but also just get over common things like the common cold. Over time, it's linked to significant health problems like heart disease, diabetes, and also obesity. Actually, not getting enough sleep is actually a major cause of obesity, very strongly correlated. And how common that is? Well, we know that about 10% of people are diagnosed with a sleep disorder each year, but I'd say that this is a radical underestimation of the amount of sleep problems that actually exist in the community. And I think estimates really, if you do a survey of people, you're looking at somewhere between 13 and 30% of people will experience significant sleep problems where they're going to require some sort of professional support. And I don't think that would come as a huge surprise to many of us that the levels are that high. So in terms of how much sleep we do need, this varies significantly. Really, it ranges somewhere between 5 and 10, but the average is 7 to 8 hours. But again, the thing to remember here is we're not necessarily talking about time in bed here. That's really important to remember. Quality sleep is more important than the quantity of sleep, or the time you're in bed is completely irrelevant, essentially. But really what we're gauging there is if you're getting enough sleep, you're feeling good in the middle of the day. And that's really what we're gauging that on. It's not how many hours you get. We all talk about 8 hours. I think we hear that all the time. We tell each other you need your 8 hours. And sometimes that's not really the best advice for people, because essentially it's about how you feel during the day. And if you're getting 6 hours, you're feeling great in the middle of the day, you don't need to stay in bed for an extra 2 hours. It's not going to do you any good whatsoever. But again, it's about how you feel during the middle of the day. If you're getting 8 hours and you're still feeling tired, you might need a little bit more. So again, it's really focused on how you feel during the day. That's your measure of whether you're getting enough sleep. It's literally your level of alertness, how you're functioning during the day. Nothing else really matters. That's what the purpose of sleep is to get us feeling good during the day. If it's achieving that, then we are getting good sleep, whether that's 4 hours or 10 hours. So just to give you an idea of the sleep pattern, and I'm only really going to look at this in a couple of different ways. The first part, I'd sort of like you to look at that sort of early night part of sleep. We're looking at sort of 4 to 5 hours, and you've got a lot of deep sleep happening there. That's the really restorative sleep that we really, really need to be able to function well. And you'll actually notice this. If you slip below sort of 4 or 5 hours of sleep into 2 hours, you'll actually notice a huge difference in your ability to function the next day. So the later parts of sleep, it's actually getting shallower. It's actually important, but it's not as important as those initial sort of 4 to 5 hours. If you're getting that sort of chunk, that's the most restorative sleep you'll have. You will feel tired the next day. But if you look at that pattern, what we're seeing there is we're getting this deep sleep. So stage 3 and 4, which sometimes are combined in terms of deep sleep, they're both examples of deep sleep. And the key thing here to remember is that early part is the most important. So if you are getting that sort of 5-hour chunk, you are getting the sleep that's really restorative. So that's really important to know. The other thing that I'd like to point out is basically if you look at these little black lines up here, you'll see that this is normal sleep, and what you'll see is periods of wakefulness. Now people get quite anxious when they're waking up during the night and they're not sleeping through. Well, the interesting thing about that is when we measure it, and we put someone on a machine and we see how they sleep, well, really what happens is that people actually wake up a number of times during the night, but they don't actually remember waking up. So it's not that anyone is sleeping through. Some people remember that, but if you're up for more than a few minutes, obviously that's more of an issue. But it's really important that people realise that there's no sleep where it goes right through. So waking up doesn't necessarily mean that you're not going to get a full night of sleep. So if you look at those sleep cycles, we're going through a number of them, and waking up in the night is actually a normal part of that. And it's only an issue when you can't get back to sleep. And most of us don't remember those moments when we wake up. I certainly don't remember those. But if we measure it, definitely we have those few minutes where we do wake up. So that's really important to remember. Now, in terms of causes of common sleep problems, I think these will be pretty straightforward to people. Obviously children, young children particularly, you've got quite a disruption to routine. And there's quite a disruption there in terms of until they're maybe 47 or 48 years of age. But really, I guess what you're looking at is those changes to routine. So a new baby coming into the home is obviously a really, really great example of that. Prolonged stress, very, very important to consider in terms of sleep problems. It's probably one of the main reasons I'll see people with persistent sleep difficulties is they actually are dealing with a significant level of stress. Trauma, so something horrific happens, you might witness that or you might be involved in that, and that really does disturb sleep. Usually that happens over a specific period of time. Things usually get better as the months go on with that. Sometimes people need some help, but it's very, very normal for it to have quite disrupted sleep after something quite horrific happens. Shift work is one of the things that disturbs sleep significantly, particularly night shift, where you're looking at night shift, day shift, so there's a lot of movement in between those. And even when you're doing regular night shifts, it's difficult to keep your circadian rhythm working properly when you're working against the light cycle. And there's a biological reason for that. Basically, we produce melatonin when it's dark and we don't when it's light, and that really is key to us falling asleep. It's the sleep hormone, essentially. So that's why you'll actually notice people working night shift will often look actually more tired. And there are things you can do to mitigate that in terms of making sure you've got a dark room at home, making sure that you are getting sunlight during the day. So if you're working on a ward or something like that, where you're inside doing a night shift, if you're a nurse, for example, the key thing is to make sure you get out during the day at some point and get some light, and make sure your sleeping environment is dark to mitigate some of that risk. Some people do it quite well. Most people struggle significantly with it. The other thing that's very, very common is medical conditions. So they can involve chronic pain. They can also involve things like depression and anxiety, very commonly have significant impacts on sleep. So we do need to get medical conditions checked if we're looking at significant sleep problems. Other areas that are problematic, sleep apnea can be quite dangerous, where you're stopping breathing. That's actually quite hazardous to your health and to your heart. So if you've got someone who's heavily snoring, it's definitely worth going to the GP about that. It's quite a dangerous thing that is not always taken as seriously as it could be, but I think has got progressively more coverage, I guess, in terms of getting the word out that that's an important thing to get sorted out. And it makes a huge difference to the way people help when they do go and get the machine and the snorkel, and that can help significantly. So if you've got someone that's snoring, it's worth checking that out. Restless legs is also obviously an issue for sleep. Menopause, old age, drug and alcohol use are the other ones that can impact our sleep quite significantly. So insomnia, as we were saying before, sort of about 10% of people are getting help with a significant sleep problem, but about 1 in 3 people have mild insomnia sometimes throughout a year. So they might not necessarily be the people that need to go to the GP, but they do have difficulty sleeping. So it's very, very common. The other thing that we really notice, if we're looking at a poor sleeper, often what we see is there's actually a development of poor sleep habits over time. You'll see this with university students, particularly when their sleep gets out of whack, and after that they do get into difficulty sleeping. Same thing with shift workers. So often it's actually the habits that we have around having a routine going to sleep. If they get disrupted, then it is an issue for sleep. The other thing that can help in terms of specialist help, obviously GP first, but cognitive behaviour therapy for insomnia can help quite well, particularly when there's a lot of thinking involved, and we'll go into that in some greater detail further in the presentation. The other thing to keep in mind now, in the long run, sleeping pills aren't really effective if they're used for a very long period of time. Great for getting people back on a sleeping schedule, but usually not for more than sort of 4 to 6 weeks. And that's really talking about benzodiazepines as the class of medication we're talking about there. So short-term, very, very helpful. Long-term, not so helpful. So if we are using them over a longer period of time, it's certainly worth checking in with your GP about that. The recommendation are that they are not used for large amounts of time, but we've got a lot of people that have been using them for a long time. And the reason is because they were so effective. They helped you get to sleep so quickly. But certainly anybody that's talking about sleep at the moment and the training involved in that is steering people away from any long-term use of benzodiazepines. So that's worth talking to your doctor if you are using them for longer periods. But there needs to be a special process that you follow. You need to follow doctor's directions, because that's quite disruptive if you have been using them for a long time. The other thing that there are people that specialise in sleep. You can go to a sleep clinic. People can actually look at the way that you sleep, and if you're having trouble over years, it's definitely worth doing to sort out what the issue is. So there's lots of options there. And what I'm going to go through tonight are the most common things that do help and the most common advice. So if you're having ongoing issues, I'd actually say, get specialist assistance through your GP and referral on. But this is really general advice tonight. So some of the common things that help probably the most is actually just understanding what normal good sleep is and having a good sleep routine. So if we talk about sleep hygiene, that's probably the most important thing. So having a good routine that helps us go to sleep. I mean, we can't make ourselves go to sleep, but we can do things that make that much more likely. And we're going to go into those a little bit more detail. Exercise, obviously, particularly during the day. The only time exercise might not be so helpful is later in the evening. But exercise during the day is key to wearing out your body so that you can actually get a decent night's sleep. The other thing is relaxation strategies can be really important. If you're someone who's experiencing stress, as we were saying before, stress is a very common cause of sleep problems. And other behavioural and psychological strategies sometimes can be quite appropriate to assist. So, as I was saying before, we really do want to get a health check if we're having trouble with sleep. Often what we can be looking at, if we're looking at prolonged difficulty with sleep, it might be looking at another underlying cause. It's usually not by itself. Usually might have some other physical health concern. There might be some mental health concern like depression or anxiety, but usually it doesn't just exist by itself. There's usually something else going along. So first point of call for a significant or ongoing sleep problem is to check in with your GP. Discussing medication is always important, which is obviously involved in a GP visit. And again, the advice is benzos over a long period of time can be quite detrimental to your sleep. Again, that's something to discuss with the GP. I'm not really going to spend a whole lot of time on medication, other than to say it can be very useful in the short term. We look at the things that are used, and this is just more in terms of it can be informative to understand some of the things that do help. So if we look through, we've got our benzodiazepines, we've got antidepressants. So that's actually tied to two things. Depression actually interferes with sleep, and anxiety also does. Antidepressants, particularly SSRIs, can assist with both of those and assist with sleep. Melatonin is the other one, which is the hormone we've been talking about. So you can take the hormone melatonin, particularly useful if you're having trouble getting back onto a routine. For example, jet lag is where it's used quite routinely. But again, that's something that you just discuss with the doctor, but I just thought it was worth going over because they're commonly used, very good in the short term, but can be problematic longer term. So the other things that we need to consider are those everyday things. And again, when I talk about these, if you're sleeping well, please ignore this advice because some people have a cup of coffee and they sleep fine and they have it at 9 o'clock at night. So this is really advice we give people when they're not sleeping, and this is the first things that we try and the things that work. But if it's working, don't change what you're doing. I think that's really important to remember. So really we want to limit caffeine, particularly in the later afternoon, about 4 hours. The interesting thing about caffeine is it's got about an 8-hour half-life. It doesn't feel like this, but about 50% of it is still in your body 8 hours later. So it can impact on your sleep significantly. So we really recommend at least 4 hours if you're having trouble sleeping, is to really remove that out. Caffeine is actually in a number of other drinks as well. Obviously, tea's got less caffeine than coffee, about 1/3 when it's in water. But even things like chocolate also have caffeine in them. So they can be things that you can look at if you're having trouble falling asleep or staying asleep. Diet's really important. Having a healthy, balanced diet, it's really important for your energy during the day, but also does help you sleep better as well. The other thing that's quite important is the routine with your meals. And really, sleep is a lot to do with routine, good sleep. But making sure you're having those meals at regular times, particularly that evening meal. If you mess around with the timing of that, it can impact your sleep. If you have it too late or too early, having it too late will often affect your ability to fall asleep. Having it too early or changing the time, you might wake up a little bit hungry. So the actual routine is very, very important if you're having trouble with sleep. The other things that really do matter, again, if we're talking about a bedtime snack, obviously that's a bit different than a main meal. That can be quite a helpful thing if it's a part of a routine. You might be having a more warm glass of milk and something small to eat. That can be quite helpful. The other one is alcohol. Now, a lot of people would quite dispute this because they'll have a drink and they'll fall asleep. And that does work in terms of they will fall asleep, but they're certainly not getting the same quality of sleep. Alcohol really disrupts sleep. So if someone's drinking later in the evening or any time during the evening, essentially, they're sleeping, but they're not actually feeling refreshed. Often that can be one of the things to remove, because even though it does really help someone fall asleep sometimes, it doesn't help them have good quality sleep, which is something we need to keep an eye out for. Nicotine, so nicotine's a stimulant and it can have an impact on sleep, really falling asleep or staying asleep. It's actually not as common as alcohol in terms of the reduced quality of sleep, but can be an issue because it is a stimulant. It actually absolutely can keep you awake. So that's another one that we'd say certainly remove the before bed cigarette if you're a smoker, and remove all of them if you can, because it's just a good idea. The other thing that we were going to really focus on is often what we're looking at is what happens during the day. So exercise is really, really important. And that can happen right up until early evening, not exercising late at night. That will wake you up and disturb your sleep. If you're having a lot of problems, I'd really recommend moving exercise to the morning because I just find that works quite well anecdotally. But basically the evidence is exercise anytime during the day up until sort of early evening will improve your sleep. Other thing is practicing relaxation techniques. You need to do this during the day. You need to practice them a lot if they're going to work. And we'll go through those in a little bit more detail. But essentially it's what works for you. But again, you need to practice it quite a lot before it will work when you're in bed. The other thing that I think can be really important is not taking your troubles to bed, particularly if you're in a high stress sort of situation. Work out what you need to do before you go to bed. Don't lay in bed thinking about what you need to do. If you're doing that, get out of bed. The other thing that is very hard sometimes to avoid is the daytime nap. And if we're having people not sleeping through the night and having significant difficulties with sleep, the first thing we want to do is remove that daytime nap or remove it down to about 20 minutes. People don't like this, obviously, because they feel really, really tired. And the nap is quite refreshing. But if you're having trouble with sleep at night and you're not getting quality sleep there, you've got two options: either remove it or get it down under 20 minutes, because it really can play havoc with your nighttime sleep. I think probably the most important thing with sleep is bedtime routine. So we can't make ourselves go to sleep, but we can con ourselves into it. Essentially what we can do is follow the same pattern every night, a relaxing pattern where our body and mind knows that we're about to go to sleep, prepares for sleep, and like a habit, we fall asleep much more quickly. And I think this is the thing that actually helps people the most. It takes some time. It's not a one-night solution. But again, really following that same relaxing routine before bed. So that might be a warm shower, it might be a bedtime snack, it might be a quiet activity, reading or listening to music with dim lighting. Really making sure that it's not involving a screen because of blue light. We'll talk about that a little bit more. Again, it doesn't matter so much what the activity is, as long as there's that sort of routine to it. So your mind can sort of follow that routine and fall into a pattern where they know that we're going to wind down to sleep. So it's a really important thing to do. You would have seen it done with children a million times, so it works quite well with adults as well. So it's actually very important that we have that routine. The other thing is, if you're having trouble particularly, wait till you're tired to go to sleep. Don't lay in bed. That's probably one of the worst things you can do. If you're not tired, you go to bed, you toss and turn, you get frustrated, you will not sleep. The other thing that's really important is just actually your bedroom, really important. So looking at a comfortable bed and bedroom, it needs to be quiet, dark, and comfortable for sleeping. That's actually, it seems so simple, but often people actually do forget about it in terms of their bedrooms can be quite chaotic. So the more ideal that room is set up for sleep, the better. And the other thing is that, so we talked about it being dark and comfortable and a good temperature, and that's all great. The other thing is you don't want to do anything else in bed. You don't want to be taking your phone to bed. You don't want to be certainly taking your laptop and working on it. You want to have that reserve for sleep, because we're talking about it as habit being so important. If you do other things, what your mind does is it pairs it with other things, not with sleep. You just want your bedroom to be a place where you sleep. The other thing that I'd say as well is that the screen thing is a big issue. And we've seen an increase in sleep problems over the last 10 years with basically smartphones, essentially, is what's been happening. So people have been taking smartphones to bed. So they're engaging, they're looking at things they're interested in. They've also got the blue light. So blue light looks like the light outside. If we've got blue light coming in, our body does not release melatonin. It thinks it's daylight. And that screen, if you're looking at my screen there, the blue sky behind us, kind of makes sense why blue is an issue in terms of having that blue light come in, not having that melatonin release, which we need to fall asleep and stay asleep. So if you're having trouble, keep those screens out of the bedroom. And the same, look, I think I'd have to bring it back again to, some people do watch TV and fall asleep and that works for them. So don't stop doing something that's working well for you. I'd say that again. But again, if you're having trouble, this is one of the first things we try, along with removing caffeine. So what I'm going to do now is talk about, well, generally, but more about sort of areas of, or types of patterns that people have in difficulty with sleep. And we're going to go through how we assist those people that are having a particular pattern of sleep difficulty. So the first one is basically that difficulty falling asleep. So some people wake up in the middle of the night, some people wake up early. There's different kinds of sleep issues that people have. So the first one, if we're talking about difficulty falling asleep, the key thing here is, if we're addressing that, is we need to look really carefully at the nighttime routine. Really, really important. Do something relaxing before bed, really important as well. And as I was saying before, if you can't go to sleep, get up. Don't lay there for more than about 20 minutes. And that's pretty blanket advice, essentially. If you're in bed for more than 20 minutes, the result of that's probably going to be frustration. Get up, go and do something dull that's relaxing. Don't do anything too stimulating. Wait till you're tired and then go back to bed. Again, avoiding caffeine after lunch can make it have difficulty falling asleep. And again, no naps if you're having trouble falling asleep like that. So that are the main sort of advice we're looking at with someone with difficulty falling asleep. So if we're looking at delayed sleep, so these are the night owls, the people that stay up way too late. We're talking about a pattern, not the natural pattern where people are, they're night owls and they're fine, they're getting enough sleep, but people that aren't going to bed or getting sleep at a reasonable hour. What we're looking at there is a need to reset the body clock, the circadian rhythms. So the way that we do that is we really focus on both going to bed, but also getting up at the same time each day. Now that might sound a little bit contradictory, because I was just saying wait till you're tired to go to sleep, and I still say that, but what we say there is aim for a certain time each night, and the key thing is get up the same time regardless. The time that you get up is actually probably more important than the time you go to sleep. Don't try and stay in bed because you'll get into a problematic pattern. The other thing that's really important is that that hour in sunlight, at least 1 hour, and really what we're recommending if you're having trouble with the night owl pattern is that it's daylight in the morning. So you're getting up and you're getting into daylight, because we're trying to reset that rhythm. So first thing in the morning is best, get out in some sunlight. And really on the other side, focusing on making sure that we've got a dark bedroom in the evening, but then letting in that morning light as soon as we get it in the morning. So we're trying to get that rhythm back on pattern with the melatonin. The other thing that is a common pattern, so waking up at night and not being able to go back to sleep. Probably the most common cause of this is stress. It's not the only cause. Other things wake people up and they have difficulty getting back to sleep. Things that we find work most for this particular pattern is relaxation. So practicing that during the day. Meditation can be quite helpful. Get up and do something non-stimulating. So get up and do something dull until you're tired. Same bedtime, get up time. Same sort of advice there, really. But the difference is, I guess, we do need to look at some relaxation strategies. Now, you need to practice those during the day before they'll work during the night. But the advice is actually the same. If you're waking up and you're not being able to get back into a sleep, even if it's the middle of the night, you're tossing and turning, get up and do something dull and wait till you're tired, then go back. Because the longer we spend in bed when we're not sleeping, the more difficult we find it to actually get sleep in a routine kind of way. We start to associate bed with not being able to sleep, which can be a real issue. The other one that's really, really common is ruminating thoughts. Now, this is those thoughts that go over and over in your head. So it's like a cow chewing its cud is what this is. So this is common both for people not falling asleep, but also waking up in the middle of the night. And the way that we find that is quite helpful for people here is to actually write those down. So get them out of their head. Use distraction techniques. Now that can be counting. I mean, that's why people talk about counting sheep eventually. You know, that's what they were really actually sort of fighting against there, is doing something that is distracting from that thought. And the other thing that's probably the most helpful is actually spend some time on it during the day. So that's what I call worry time. So worry time is really important in terms of I'm going to worry about it during this time. I'm not going to worry about it during the night. I wake up in the middle of the night, I write it down, I worry about it when I worry about it during the day. That can be really, really helpful. And obviously working towards problem solving and action plans. Once you've got a plan, things that you're worried about don't stress you as much and they don't wake you up in the middle of the night once you sort of can see a way out. So that's really important as well. You can do that. It's a very good thing to do with a friend, actually, the problem solving and action plan. It's a great way of doing it. And once you've got a plan, often the stress reduces. Now, the other pattern we see is the lark, and what this is a person that goes to sleep early, but wakes up way too early. So not a problem for an early riser, but this is people that are waking up at 4 a.m. or earlier than that when they don't have anyone else around, and it's not particularly pleasant for them. A very common pattern with depression, actually, not only with depression, but common with depression. And essentially, we do need to reset the body clock here as well. So it's slightly different in the advice we give. So what we're looking at here is basically, we recommend trying to stay up a little bit later. So moving in sort of half-hour increments. So what you're looking at there is if you're going to sleep really, really early, and then you're waking up way too early, we move it in half-an-hour increments each night until we're getting to a point where we're actually sleeping through to a more reasonable hour in the morning. Now, this is kind of the opposite advice to the night owl. Essentially, with the daylight, it's really important in the afternoon. So we want to make sure that we're getting some sunlight in the afternoon. So we're looking at regulating our melatonin there, getting back onto a good rhythm. Again, dark bedroom is really important. I guess the concern here is that people do get quite tired during the day, particularly when we're asking them to stay up a bit later as well. And if people do need to nap, we're looking at a short nap. Look at about 20 minutes. That's the least disruptive. So that's what we'd say there. Overall, just with poor quality sleep in general, some of the key things that really help, checking your medication with your doctor, whether that's sleep medication or other medications. Review your diet generally. That can make a big difference. Increase in exercise. Wearing out your body is one of the best ways that you can get improved sleep and deeper sleep. Doing some daytime relaxation. Now, you'll see this a lot with people. They're tired, but why? They're very, very tired, but they're still quite stressed and still running at sort of full revs. So doing some daytime relaxation can be really important. And that can be anything from gardening to doing a walk in the evenings, a really good one. But really important that that's done, because a lot of people do get that tired and wired feeling, and it's not helpful. And again, as I try to say this as many times as I can to people, basically don't stay in bed and try and make up for lost sleep. The longer you spend in bed not sleeping, the more difficulties you will have with sleep. So if you're not sleeping, get out of bed is the advice. And as always, see a GP and get specialist advice if required. Now, this is probably the most disappointing part of the presentation, which is that it all sounds very helpful, but it does take about a month. So you need to practice these things for a month to see a significant impact. So I think that's really important to know from the outset, is when you're making changes to improve sleep, often you won't see you won't see that optimized, I guess, for a month, because it's a pattern and a habit that we need to build up, and it takes about 4 weeks. You will see an improvement over that time, but just to keep it realistic, I guess it's important to be aware of that. And I guess the other one that I wanted to emphasize is really a lot of sleep problems are about what happens during that stress. So yeah, that's really, really key. Is that really, if you have issues going during the day, really focus on those. and that will actually assist. So in terms of information, well, this is all going to be available online, but there's some really helpful websites. Sleep Health Foundation is really fantastic. Reconnection is they've got a lot of free resources. If you're having difficulty sleeping, they'll send you out a DVD if you've still got a DVD player. They've got some great resources that have really good information on improving sleep. And the Australian Sleep Association also has some brilliant resources as well. All three are really good online resources, but if you're looking for something that you can actually get it sent out, Reconnections is probably your best option. And now we're moving on to the questions part of the presentation. So we'll see how we're going with there. What have we got in terms of anything that needs clarifying? It's obviously very sort of general advice for some general patterns that we see with sleep. But often...
Tim, we've had some great questions come through. I'll refer you back up to the first one from Andrea. She's had a light bulb moment, which is excellent to hear. So of all the time people have talked about sleep, they've never mentioned the timing of the evening meal. Is there a suggested time frame to have an evening meal?
Yeah, you look at about 3 hours before you go to bed. That's what you're looking for.
Yeah, and I think, and Tracy was also wondering about the same thing, like she's always heard about the meal, not to eat too late because it puts on weight. So it's also important now to also, it affects your sleep pattern. And that I think comes down to digestion, doesn't it?
Yeah, well, it does. I mean, I think it's the other reason that you'll actually see an increase in obesity with people who have difficulty sleeping, because what do we do when we can't sleep? We snack. That's the other thing, and we're not moving around at night. So if we're eating larger meals at night and we're snacking particularly later into the night, we will be at risk of putting weight on. But it's one of those natural things we're inclined to do.
And I think in the bush particularly, we're probably pretty good at working those long days, come in after dark and have the big steak and 3 veg, and we all go to bed with full bellies. So maybe we just have to have a change of behaviour there as well. Good luck. So Wendy also mentioned as a suggestion, she has a notebook next to her bed for those naughty ruminating thoughts. It works for Wendy, and others might also have that strategy as well. Erica, though, she dreams solutions at night but can't remember them. I also do this too, and I'd love to think maybe we should wake up when Erica and write them down, but I think the mind would then just start whirling away. So interesting. Erica is asking any way to bring those back when she's awake of a morning time.
So you both need a journal by your bed, by the sounds of things.
We do. Actually, it's amazing what you do think of subconsciously when you're asleep. Robin's mentioned, is it bad to listen to radio? What about calming music or podcasts? Any ideas, everyone?
I absolutely recommend that. In terms of that relaxation music, podcasts can be quite good. The general recommendation is relaxing music's better, particularly if you do get sort of tied up in a podcast. But I actually personally find a podcast quite effective, but it depends on how caught up you get in it. It's a bit of a trial and error one, and it's not general advice other than I can say that it does work if you're listening to radio and you fall asleep. I think a lot with sleep is really trial and error, and I don't think we can really ignore that, is that if you find something that works, really use that. If you're getting good sleep, you've got a pattern that works, I wouldn't change that. And if it's music, if it's listening to, even if it's talkback radio, whatever it is, if that actually helps you get to sleep, even if it's a TV in the bedroom, which, I tell people not to do ever, like it's the first thing I tell people to get rid of, but some people actually find that very, very helpful to wind down. So it is about finding what works. And again, that advice is really, if you're having trouble sleeping, these are the things that we try. But if you've got something that works, don't go away from it.
It's fine. It's interesting, Tracy also made a comment, and I'm guessing, Tracy, you're referring to your older, like your parents who are older, that they're happy to listen to the radio in the background for that noise, like they find that rather settling. I know my daughter, she actually likes the air conditioning on even now in wintertime because of that, the whirring engine because we have the old box air conditioner. So it's a comfort factor as well.
Yeah, well, I mean, that's a great thing, Susan, because what we look at there is when you're looking at white noise or the sound of an air conditioner, what you're doing is a change in noise. So what we wake up to is not noise generally, it's actually a change that brings us out of sleep. So that's why that can be quite effective. Yeah.
I have heard of a theory of babies even, if they can't go to sleep, actually, this might be a bit out there, but putting the vacuum cleaner on in their bedroom because of that noise. And they're, I see a few nodding heads, so maybe it's not so silly after all, but I'm long past that, so that's good. I'm happy to open the floor up if anyone would like to make any comments while we're having this discussion. You're very welcome to, but some other great tips have come through from Adrian and Wendy. They're into the breathing. So in for 4, hold for 4 and out for 4. I think Adrian, she goes as far as 7, is it, counting to 7? So I think they're really good tips, and that also helps that taking the mind off those ruminating thoughts as well, like the counting sheep, holding the breaths.
Yeah, absolutely.
Julie, what about the morning? What is it about some of us that aren't morning people? Exactly, I get that. Is that a reflection of a bad night's sleep?
Well, it can be. There's many people, I mean, there are many people who just aren't very good in the morning. It's not necessarily because they're having poor sleep. There's definitely a difference in pattern between people who are really, good in the morning and not so good at night, and other people are more alert at night. And it's not always an indication of poor sleep. It can be. And it's really, the way you tell that is, does it go away within a couple of hours? So people can be sort of groggy when they wake up and not so pleasant to be around sometimes. But really what you look at is over the whole span of the day, are you feeling tired? It can be a very normal thing to just not be a morning person. But it's more about, if you look over the span of the day, on average, you're feeling pretty good. If you are, then you're probably getting enough sleep.
Excellent. And why do I wake up 2 hours after I've gone to sleep? I guess we're getting back to that cycle.
Yeah, so you'd be looking at 2 sleep cycles there. Why it would be 2 hours?
Oh, hang on. Sorry, there's this. Oh, sorry, that's right. Yep. After 2 hours after I've gone to sleep. So if you wanted to come off mute and just describe do you go into a deep sleep at that time, and then just suddenly wake up?
Yeah, thank you. Yeah, I don't know why. It doesn't really trouble me, but I just know that if I go to sleep at 9:30, I'll be awake at 11:30 and think, oh, what is it? So I was thinking maybe, I don't know what it is. It doesn't trouble me, fortunately, but it's just an observation that after I've gone to sleep that I'll wake up, and that I am aware of it, that I'm waking up and I think, oh, again.
So, well, I guess it's actually completely normal to wake up, but you're remembering it. It depends on how long you're awake for. So that's actually very normal to wake up. You're waking up at the end of a sleep cycle, and then you do go into that period of being awake. So that's completely normal. Everyone does it. Not many people remember it, but it's only really ever an issue if you're having difficulty falling back to sleep. Otherwise, it's just a completely normal part of sleep.
Okay, thank you.
Another comment here from Wendy Wachner. I use the notebook strategy and also podcasts, both help. I try to listen to one that I'm not really into.
It's a good plan.
It's a good tip. Robin, do nursing homes make the elderly get out into sunlight? We would hope so, but
sometimes.
Interesting question. Yeah. It's definitely, that would be a really great thing to check if you've got any elderly in the nursing homes that you know of. Okay, so sorry. Oh, sorry. So Robin, you continue. Sorry, the sunlight issue. Do nursing homes make sure people get out? What happens when they don't? Yeah, it comes back to your vitamins.
Yeah, I mean, people that have, that don't get sufficient access to sunlight. I mean, there are vitamin B, melatonin as a hormone can assist. I mean, we do see the impact. I mean, if you look at the Northern Hemisphere, there's actually quite significant impacts. If we're looking at a whole lot of people living in areas where there's no light, which is the same as being indoors all the time. So there are health impacts of that. I mean, it would be good to think that people do always get outside of nursing homes, but I know it's not always the case for certain. But yeah, it is an important part of health if we can get people out. But no, it doesn't always happen.
It's also connected to depression, isn't it? If you don't get enough sunlight in your day, that I forget the name of it. Sorry, but when as you say in the northern hemisphere, the grey sky depression it's known as, because it's always gloomy. If anyone else knows what I'm talking about.
SAD, sad.
Sad. All righty, so that's it from the questions. So if anyone would like to make any more comments. Oh, yeah, Andrea agrees. Yes, the depression is very common in cold climates.
So if you don't get a good sleep tonight, we'll expect a raft of complaints tomorrow morning.
Actually, it's a good thing we're here for another, 7 more series, so we can maybe check in a month's time to see how we're all feeling with our sleep.
Thank you very much, Tim. Sorry, go on.
No, go ahead. Thank you very much.
Oh, I just wanted to say thank you very much, Tim, for the presentation, and also to Susan for moderating the questions. And thank you to everyone else who joined us tonight.
The critical thing for rural women is to make sure that they're looking after themselves, as the expression, to make sure you've put on your own oxygen mask before you help other people. Being agile, not fragile, really means that you've got that, a suppleness and an ability to sway in the wind and not be blown over. I think it's important that we actually learn skills and techniques for managing the feelings that can sometimes be quite overwhelming, particularly when you're going through change and crisis.
In crisis, there is opportunity. The classic example of that, I think there was more millionaires made in the Great Depression than any other period in history. Having something to strive towards and having that sense that you're moving forward with your life is very, very important for your well-being.
This webinar series is an opportunity to get some new tools, but also to look at, are you maintaining the tools you've already got? How do you be in a position where you can take advantage of what the opportunities are coming out of a crisis?
Not only giving people great information about well-being, but also giving them some great information about how to improve themselves professionally. People have shown remarkable agility to deal with extraordinary demands, but it's also important that while people are doing that and running on full revs, that they are looking after themselves at the same time so they can maintain that resilience over time.
I think one of the important things about this webinar series is that the people involved understand rural Queensland, they understand rural people. You can have privacy, you don't need to identify yourself when you're asking a question. There's lots of opportunities, but you need to look after yourself so that you can actually take advantage of those opportunities and be in a position to look after the people around you and make sure they're ready for them too.